Hey everybody, this is Kayla Jacquez. I am your regional manager from GD. Some of you I may have met already. If not, it's great to meet all of you. A little bit about me. I do come from Missouri, a very clinical background of fire, EMS, ED of about 10 years or so. So I speak your language. I'm looking forward to giving you your new eBridge model, and I hope it brings you guys a lot of success. So let's dive right into this. First things first, just a little tip and trick on how you guys are logging into the platform. This is something that I like to show, my guys that are using it out here. Is whenever you're logged in, you press the eBridge icon, it should take you directly to this screen. If it does not, so for example, if you press that eBridge icon and it takes you to a screen like this, hopefully you guys are all aware of how this platform works since you've been using it. But again, this can be used for new employees as well. So once you click which crew you are, and again, you're not going to have all these people over here, to the left. You're not going to have all these blue faces. You should only have one, and that should be your truck number because this application is automatically going to know who you are, meaning your unit number, and how far out you are with live GPS tracking. Okay. So again, it should be very, very simple to log in and log out of this, and you really should never have to log out. So it should be simple, stupid for you guys. Another piece I want you guys to keep in mind with this new model is please, whenever you're sending transmissions to the hospital, right, and you're using this, please don't ever completely swipe out of the application, okay? That like shuts off the communication for some reason and it tells the system to stop tracking your GPS coordinates and things like that. So it can be really confusing on the hospital side. So please make sure to just go ahead and leave eBridge up and running in the background and never really swipe out of it, okay? Now, what you'll notice on your home screen is you have less buttons, which is great, and hopefully in the future you'll have even less to look at. But for right now, this is what we want to go over. You'll notice these four right here that we're going to focus on today. You still have your refusal form that has not changed. You have your pronounced death, your medical direction. Those are all going to remain the same processes, as well as your MCI declarations and transport notices. Okay. What we're going to focus on is your priority one, two, and threes. And we're going to utilize this through your EMS report button, your STEMI button, your stroke button, and your trauma button. Now, I have been implementing and training on this here in Missouri and some other areas in the Midwest, and we've seen fantastic success with this model. Basically, your green EMS report button is going to be able to take place of your report for any of your medical calls that are transmitting into the hospital, right? So if you are calling via radio or phone, whatever your process may look like, you now are going to be able to use this platform in place of that piece of communication. So this is not going to be an additional step. This is your step to communicate to the hospital. And with the EMS report, what I like to teach the EMS guys and gals is this button should be used for anything where you don't need a response team inside the hospital, right? So for STEMI, it speaks for itself. If you think that the patient is going to need to be activated, whether you're teetering, right? Is it a STEMI? Is it not a STEMI? Always err on the side of caution because this then ensures that you have the best team available when you arrive. Make sure you're using that STEMI button. Same for stroke and same for trauma. This is letting them know, hey, this is what we think is going on. Make sure you have that team available when we get there. And trauma is built for your scrape on the knee versus your full-blown level one vehicle accident. Okay, so any type of trauma can be built into this button here. Stroke obviously speaks for itself. Same for STEMI. All your other patient reports will fall under this green EMS report button. Alrighty. So essentially, when you press any of these buttons, you're going to have the hospitals available in your MCA or, neighboring areas, what that may look like. So we're going to go ahead and pick a hospital here. Up at the top is where all of your attachments are going to live. And before I dig too deep into this, this is now going to be a live environment for you. So those of you who have been using eBridge, it used to be a kind of like a PDF that you were sending back and forth. I don't want to say it wasn't user friendly, but personally, it wasn't something where you could actively update, right? You weren't in live communication with the hospital. This is now the platform you have. So you essentially are able to have this live sheet that you're able to fill out. You then are able to invite the hospital to the conversation, and then you guys will be in this live thread with one another throughout the patient's care and transport. So that's kind of the difference here is it's no longer this PDF or message that's being manually transmitted and forwarded. It's now you're starting a live communication thread and you're inviting the hospital into it, and you guys are now able to communicate in real time. So it's just some more modern functionality for you. So up at the top on all of your forms, you're going to be able to have quick attachments. Now, quick attachments involve quite a few different options. You're able to take a photo. And when you take a photo within the eBridge platform, this is actually, a HIPAA secure environment. So the photo is not going to be saved on the actual device. Now, when you grab a photo from your device itself, and this should be on all your truck devices, not personal, this is going to be great, for example, when you're on scene, you take a picture of a vehicle accident, you're going to be able to go back in and grab that photo and pull it into here if you need to. Okay. A lot of us, I know I'm guilty of it. I got in the habit of taking pictures of vehicle accidents, sometimes on my personal phone. After I got my hand slapped a few times, I started using the truck phone, and then I'd be able to, show the ED whenever I got there. Now you have the ability to show them before you arrive. This is going to help alleviate a lot of that natural rub that all of us run into where we're trying to describe something, but they're not able to see what we're seeing, right? So you now have the ability to put eyes on what you're dealing with prior to you arriving. So that way they can better understand what's going on and how to be best prepared for you. So please, please, please use the functionality you have available to you, test it out, get used to it. I know this has changed. We're all great at it, right? But over time, I can promise you that you may lean to start wanting to use this type of communication here in this area. I was a little, I don't want to say um, pessimistic, not optimistic, whatever you want to call it. I was a little on the side of I don't think it would be used near as much in my area just because I came from it, right, and worked in the field. But we have over 60% usage in just a few short months. So a lot of the guys and gals, like I said, are loving using this communication. So I'll get off my soapbox there. Taking a picture, grabbing a photo. You can also record a video. Now, this seemed really silly to me in the beginning. I'm not really like a TikToker or something like that wants to sit there and take a video of something and send it. But I have found quite a few instances that have proven to be really successful. One is kiddos. Okay. I got a 1 and a 2-year-old at home. Kiddos are just a soft spot for everybody. It kind of gives you that pucker factor. If it doesn't, then you might not want to be in this field or, get out of it. Anyways, kiddos, this is going to be helpful for, again, describing what's going on. The simple fact of you trying to translate how this kiddo is presenting versus you being able to, take their shirt off and show how they're breathing, right? Do they have retractions, tracheal tugging, whatever the case may be? A quick 5-second clip is going to ensure that you have the best team available for you whenever you arrive. That's going to help everyone understand exactly what's going on without having to provide a ton of information. So kiddos have been proven to be really successful with videos. It's just easier. Strokes, right? So strokes, I know I'm a little rusty. I've been out of the game for a little bit, but I used a Cincinnati stroke scale when I was in the field. Now in this area that we're in, BFAST is the gold standard. Then you have a LAMS, then you have FAST ED. You have all these different stroke assessments, but the truth of the matter is all of us are going to continue doing a very similar stroke model that we've always done, right? We may add an additional step here or there based on time and things evolving and figuring things out. But all of us are going to do our stroke assessment very similar to what we have done. On top of my stroke assessment may be looking a little different than your stroke assessment. We each have our own little tips, tricks, niches, etc. that we do. So what's great is instead of you having to not necessarily describe what you provided on a stroke assessment over the phone or through this application, you could take a video clip, that could then be shown to the ED physicians or specialty teams. So that way, essentially, they can see how that patient's presenting prior to you arriving. Here in my area, we've seen great success with this. Of course, it was changed and a little rusty in the beginning or a little rough in the beginning, but now the crews are using it and it's working out wonderful. So, again, if you have the time, you have the resources, please test this out, use it, record your stroke assessment so that way the ED and the stroke team can actually see this and compare. They also may catch something that you didn't even realize that you were testing for, which is another great thing. And last but not least, being able to record an audio clip. So this is something I know you guys were trying to use eBridge for actual live, like audio calls, right? Calling back and forth through the platform. And we were running into some issues maybe with some data and things like that. This is a great way for you to be able to record, your regular radio or phone report that you would have given, and it's going to now live in this platform. So that way you can send it to the hospital. So that's just another thing you can use this for if you would like to. This is going to be more of those down and dirty situations. I don't have a lot of resources. I just want to be able to give you my quick report as much as I can and, send it over. So that's another option. And then EKGs, if have a Zoll monitor, this actually links up via Wi-Fi and Bluetooth. So we'll make sure to send you those instructions if it's not already linked up. You'll be able to pull in your, PDF of your EKG via Zoll. If it's LifePak, you're going to have to take a photo. So that way you can get that EKG over to the hospital. But I will tell you guys, I think photos are just a little bit quicker as opposed to relying on, data and technology to communicate. So I like photos. That said, we have to make sure we take a solid photo so that way when it reaches the hospital or the cardiologist, whoever, they need to be able to actually look at this photo and it not be fuzzy. So if it's a fuzzy photo, it's not going to do any good, for your patient. So please make sure if you are taking photos of your EKGs or your monitors or whatever, that it's a decent photo that they can grab. So I'm just going to go through and show you this stuff really quick now that we've sort of talked about it. So as far as photos, whether you're using an iPad or a phone, you'll notice this is a little fuzzy here. Just make sure that you're tapping the center of your screen to make sure that it focuses. Okay. We do this every day in our personal lives, guys. We're taking photos all the time. So please, 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 I cannot reiterate enough. Please take a decent photo. You're also going to notice this light blue box that now lives here. Anything that you attach will live in this light blue box. If it did not attach successfully, right, whether due to user error or whatever the case may be, you just need to keep in mind it needs to live in this light blue box in order to ensure that it has actually attached. All right. Now, if I go to grab from my recent photos, you'll notice these recent photos here. Let's say I pull that in and it's now also attached here. Same thing with a video. Okay. It's pretty straightforward. You just press record. It's going to start recording here. You can press stop and then you can replay the video if you would like to look at it, or you can just press use video and that's automatically going to upload there. You can also delete as well. So you can press this little X here and that's going to delete the attachment. So if you accidentally, added too many things, you can go in there and adjust that if you'd like. Now, please pay attention here if you plan to use this audio recording. There's one step in here that you have to ensure that you press in order for it to attach correctly. So you can go ahead and press record, test 1, 2, 3, test 1, 2, 3. You'll press stop whenever you're done. Now, keep in mind with this, it's not something where you have to keep it, directly up to your mouth or anything like that, but please make sure that the device is somewhat close to your face so that way it can have, a solid recording. You can replay the conversation or replay, your audio clip if you want to. I personally don't want to listen to myself talk, so I'm not going to do that. But what you have to do is press this attach paperclip here, or it will not attach to the case. Okay. So once you press this attach button, it's now going to live in this field as an audio clip. If you do not do that, so let's go ahead and delete this. So let's go in and let's say I press record, right? Now I'm recording 1, 2, 3, 4, test 1, 2, 3. I press stop and then I don't press attach and I just go back, right? Go back to the case. It is not living in this light blue box. All right. And then you're probably going to be like, oh, damn it. Let me go back and grab it. It's gone. So that's really going to piss you off, especially if you have little resources. It's the down and dirty, quick way that you're trying to use this new model. You recorded yourself for 30, 40 seconds, and then it didn't even attach, right? So please keep that in mind. And then again, this EKG button, that would pull up a white screen, show you all the recent EKGs you've taken or PDFs. You pick which one you want to pull in, and it's going to pull in as a PDF doc. All right, so those are all your attachments. Now we're going to get into your priority level. Priority level is really subjective, but it's simply just providing the hospital a solid view of what's coming in. So I like to call it, their EMS bed management, essentially. Now, some of the hospitals may be using, I know here we use Epic, so we have this like white bedboard screen whenever we walk into the hospital with our patient. We look to the left or the right or in front of us to be able to see what room we're going to, and that's all placed on a bed hold. So now that bed hold is actually no longer something we look at. Now we look at this screen here that's powered by eBridge. So whenever you're able to fill this information out, you send it to the hospital receives it. They're able to assign a room number prior to your arrival, and you will be able to see it not only on your device, which I'll show you later, but also on these dashboards are what we call them. So the dashboards, again, should be something where you're able to view whenever you walk into the hospital, if that's something that hospital does. So you'll be able to see which room you're going to. And these are also placed all throughout the ED. It really just depends on what the hospital is using internally. But regardless, that's kind of the motto of everything. So for your priority level, since you guys have 1, 2, and 3, we are basing it off of color coding. Okay. So your priority ones, which are high priority, right? That's going to be red. Your priority twos, which are medium priority, those are going to be yellow. And then your low priority, which is going to be green. You guys already know all of those protocols and what that model looks like. So just know based on this, if I click low, it's going to be green. That means it's my priority 3 versus 2 versus 1. All right. So let's bring this up back to our center. That's the priority level piece. Next, we're going to go into demographics. So with demographics, we now have driver's license scanning, which is super quick, super efficient. But we also understand that driver's license aren't always available, right? It's not something where you walk in and it's just going to be readily available for you on the kitchen table or someone immediately can give it to you. It might be something you have to dig for a little bit. And the last thing we want to do is avoid treating the patient because we're looking for demographics. But I will say that in hindsight, one thing I've learned, I felt really stupid after 10 years in the field, is the hospitals heavily rely on demographics. You guys know this simply based on the fact when you walk in, registration, at least here in my area, it is down your throats saying, hey, what's their social? What's their first name, last name? Half the time you could have a critical patient that can't even talk and they're trying to ask them what their information is. And so we found, or at least what I've found, is for STEMIs and strokes specifically. STEMIs and strokes are something that heavily rely on these demographic fields because the why behind it, which we all love to know, is they need to look the patient up in their system, meaning if they're using Epic, Meditech, Cerner, whatever they may be using inside their hospital, they have to look the patient up and double check their medical history to ensure that they're a true candidate to receive cath for a STEMI, or that they're a true candidate to receive TNK for stroke, etc. So that is why they heavily rely on these demographics. Unfortunately, we can't fix the process. It's not going to change. We could sit here and argue of why do you actually need it? Why are we preventing care? Go down that whole rabbit hole. But just know they need these demographics, specifically with STEMI and stroke. Trauma is pretty used to not having demographics, right? Because sometimes we're picking them off the side of the street and we have no idea. But STEMI and stroke, it's pretty important. So we wanted to give you guys the ability to scan this information so that way, hopefully, they can look the patient up, pre-register them, and it can help alleviate some of the issues that we, naturally run into when we're transferring care. Now, you can scan the driver's license. I'll show you how that works in a minute. You can also manually enter this information in. So if you don't have the information, but they're able to at least tell you, then you can go in and put this info in. There's also a date of birth calculator. I love this for when it's 2 a.m. and you don't feel like doing math. When Meemaw, she keeps telling you what year she was born or what her birthday is, or you find something that has it. and you just don't want to sit there and we guesstimate, right? You're like, yeah, they look 70, right? They're not 70. They could be in their 50s, their 80s, who knows? So just use this to your advantage. You'll notice it starts to change. Um, Feel free to use that there. So you can manually type this information in. And keep in mind, guys, you don't have to fill out all of these fields, right? They're just here to make it simple for you if and when you do have the information or if and when it's pertinent. All right. So I may not have any of this. All I know is their birthday. Or better yet, I don't know their damn birthday. All I know is that they're a 44-year-old female, potentially. All right. So please just do your best to fill out the majority of this information. If you can get the driver's license on your time critical type patients, your STEMIs and your strokes, please do so. It also doesn't hurt to get in good practice and start using it with, your everyday patients or whatever, because this case, for example, or form is going to live on your device for 12 hours. So you'll be able to go back and look at this information whenever you're typing info into your EPCR or whatever that may look like. Okay. So scanning the driver's license, you press this green button here. Now, with the driver's license, it works off the bottom barcode. It does not work off the top. So I like getting in the habit of actually covering the top barcode. You'll notice it grabbed it right away there. I want to show you what it looks like when you don't do that. Okay, so when you have both barcodes, and again, I'm not a huge fan of iPads, but you see it keeps trying to grab from the top and the bottom. I got lucky. I have great lighting in here, but most of the time when we're on scene, we're not going to have great lighting. Okay, so just find a way, either cover it up with a piece of paper, cover it up with your hand, whatever that may look like, and it's going to grab it right away every time. Seconds, guys. Literally take seconds. Throw that ID to the side, keep it at the house, and don't worry about it. All right. So that's demographics. Next, we're going to go into chief complaint. Now, before I dig too much further into this, I want to highly focus on, please fill out what's pertinent for the patient, okay? Just because all these fields are here does not mean you have to fill every single field out. All right. I want to reiterate that. Just because a field or tab or option is there doesn't mean that you have to fill every section out. We want to keep this simple, stupid, very easy for you. So we provide you a lot of quick options for when that situation does occur. For example, a primary and secondary. Not everybody has two complaints, right? Sometimes they have 15 damn complaints. The point is trying to get the hospital to be best prepared for the patient. All right. So, what would you say during your report? Is it nausea, vomiting? Is it abdominal pain? Is it both? Chest pain, shortness of breath, right? Not everybody has both complaints. Not everybody only has two, etc. Just focus on what you need to ensure is their primary versus any secondary if it's applicable. All right, so we'll put chest pain here. You also have an other section. This other section is a great space for you to add additional information if you find that pertinent, or if a chief complaint's not there and you need to describe it here, feel free to do that. This is just a giant open text box that will grow as you put information in. I have a lot of crews who use this again to type info in, kind of like a little bit of a narrative, which you also have right here below. Doesn't matter either way, whatever works best for you. And then we do have talk to text as well. So some guys like to use the talk to text feature and find that really easy to use. Keep in mind with talk to text, it's talk to text, right? So please review the information before you press send to the hospital. We've gotten some really funny transmissions over the past few years. All right, so you have a couple open text boxes that we already went over here. Then you also have any pertinent history. Again, pertinent, does it matter? Will it affect patient care or response? You are able to put this information in if that is helpful. And you also have the other section where you can put in whatever you need to. Then you have your vital signs section, all right? So vital signs, this is the part that's going to take you the longest. I'm not going to sugarcoat it and I'm not going to lie to you, only because there's so many fields that you would have to type into, right? So with this, when I say take you the longest, I'm talking 20 seconds max, guys. It should not take you a very long time to do this. You're going to get so quick and efficient at using this if you choose to buy into this platform, which I hope you do. It's going to take you a couple weeks and you're going to be a pro. It doesn't take long. It's just change and it's a new platform. All right. So you'll notice within normal limits, your leadership is going to be able to talk to you about what those criteria are and what works best for when you're able to use this checkbox. Now, we also have the option, where you can go in and fill this information out as well. And you can leave this up and you can type this information in, for example, and you can go into here. Okay. Now, on your iPads, you're going to have this type of board. On your phones, it's even better because it's like your big calculator. So it's nearly impossible to have the complaint, excuse me, of, oh, I fat fingered it, right? That's not true. You're not fat fingering it. Okay. If you guys can text every day and you can use a calculator on your phone, you can use this platform. All right. So on a phone, it's going to look like a big number screen. And then on your tablets or iPads, if that's what you're using, this is what it will look like here. Okay. And then you can go in, like I said, fill this information out, and then you'll be able to get this here. Alrighty, so pretty straightforward, doesn't take you forever, but you also have that checkbox that your leadership will talk to you about. Next is GCS. GCS is something that the hospitals heavily rely on. And unfortunately, we are not good at GCS in the field, right? We suck at calculating GCS. I don't know why. I'll be honest too. I was absolutely horrible at it. Even when they would ask me over the phone, I was like, wait, what? I don't know. 13, 12? I forget. It's just not something that we heavily focus on. So we wanted to give you guys a quick cheat sheet here to be able to calculate this. You'll notice as I start pressing these little check boxes, the total number at the bottom is going to change. Now, what's even better is this little eye icon right next to these. This is great for your new guys or guys like me that just do not do a good job at it and need to remember. You press the little eye icon, and it's going to remind you how you should be filling out GCS. Okay, so this can just be a helpful tool for you all. Treatments, you're always going to have some options for treatments. Now, keep in mind with treatments, is it pertinent, right? If you were an A+ medic today and you have a patient who's a priority 3 going to triage and you started an IV, good for you. Does it matter? I'll let you determine that, okay? Did you give a treatment? Did you see a response? That's what needs to be transmitted to the hospital, okay? They need to understand, did you do something and did it have, an effect on the patient? So that's where you're going to have quick options there to fill this information out. Resources needed, this comes into play. Do you need security? Do you have a violent patient, right? Do you have a 500-pounder or who needs a special bed? I don't know if any of you have been in that situation. I've had, larger patients who are stuck on my stretcher for 30 minutes because they had to go find the bariatric bed. Well, shame on me for not notifying them ahead of time, right? So giving them the notification prior to your arrival is going to help you with getting that patient offloaded as quickly as possible. Pregnancy, and then of course translation services if you need that. And that's what that looks like there. Room number is not something that you fill out, and it doesn't even let you fill it out. That's something that the hospital fills out if they fill it out prior to your arrival, which they should be doing, depending on your ETA. That may vary, but they should be able to fill this out on their side, and it's actually going to update for you. So it's going to update here and show you, but it's also going to update up here on this case label. So again, if you're using another app within your iPad or whatever, and you want to go back in and say, let's see if they updated what room they're going to, go back in and be nosy and see. It'll locate up here and locate at the bottom. All right. So this is your form. This is going to be your longest form only because it covers the most variety of patients, right? STEMI, stroke, trauma, that's geared towards STEMIs, strokes, and traumas. All right. So this is just giving you, the flexibility to fill out what you need. Essentially, it's always going to be any attachments you need. You're leveling the patient with priority, demographics, chief complaint. Do they have any history that matters? Vitals, and did you do anything, right? This should take you on average 60 seconds or less once you really get started to using this. All right, so that is what the form looks like. And now I want to show you these buttons at the bottom and how this functions and what it looks like on the hospital side. So the hospital is going to have their method of communication or setup communication, meaning they may have other systems that we provide. They may just have an iPad. They may have PCs. Each hospital you transport to is going to have a way to receive this information and respond to you regardless. So we're going to press notify. When you press notify, it is going to ask you to confirm. When you press confirm, it is going to go over to the hospital. going to flash an alarm. They're going to open this on their side. Let me pull this over here. So they now have all the information that you have filled out, right? And I know on here it says test EMS, but it's actually going to have your unit and how far out you are, for example. This would automatically be filled out based on how you logged into the platform. So remember, this app already knows who you are and how far out you are, and that's automatically going to tell the hospital on their side. So no need to fret about that. They're able to see again all this information that you filled out. And their main job is to press acknowledge within 90 seconds. If they do not press acknowledge within 90 seconds, you are going to get re-notified. So I'm not going to press this because I want you to hear what it sounds like on your device to let you know, hey, they did not acknowledge you. Now, one thing in regard to service and data and things like that, this application is constantly going to send every second on the second, okay? It's constantly trying to send. So it's such a small piece of information, we typically don't see it running into many issues with this new model, all right? But if it does, please make sure to reach out to us so we can dig into the information. But you'll notice right here that the event is time-stamped. It's showing you that you did notify this hospital at this time. If this timestamp lives at the bottom, your transmission did go through, okay? So this is what it sounds like on your side if the hospital doesn't give you that acknowledgement. Now, like I said, we have been training them or will train them that they are supposed to be the ones to acknowledge you within a certain time frame. But if they don't, that is the notification you will get. Now, when this happens, if and when it does, you have three options. You can follow these options in whatever order you want. You don't have to listen to me and what I have to say, but I'm going to teach you how I would handle this if I were in your situation. Again, use this in whatever order you need to. Option one, if you get that notification back saying they did not acknowledge you within that 90-second range, I recommend using this group chat function right here. Okay. You press this open and you press group chat. When you press group chat, I would simply do one of these. Now, you may be nicer than me and want to type in, hey, did you get that? But me personally, I'm going to throw in, a couple of question marks and say, hey, what the heck? Did you get it? So then it pops up over on the hospital side. And the beauty of this, guys, is it's going to reopen on their screen. So think of a situation when they're on the hospital side. Again, give them a little bit of grace. They may be getting their asses handed to them. They may, have multiple calls going on, eBridge notifications, etc. And they may simply have just forgot to press acknowledge, right? So when you chat them, it reopens on the front of their screen. And usually they immediately realize, oh, damn, I forgot to press acknowledge, right? And they may see that group chat and immediately go, oops, my bad. And you're going to get that notification that they accepted your transmission. Okay. Now, it may sound a little obnoxious on the volume side of things, right? You had that other tone when they didn't acknowledge, and then you have this more bright tone when they do acknowledge. But remember, fans are running in the back. It's loud back there, especially on scene and things like that. It's not going to be a quiet scenario like we're in now. All right. So it's not going to seem near as bad. But either way, you're going to get that transmission then. So let's say, you group chatted and then they immediately acknowledged you. Awesome. Now you're en route and you're good to go. You guys are in a live thread with one another. They also will show this timestamp down at the bottom. You notified them at this time. They acknowledged you within this time. All right. And it's also going to have that data, the timestamp showing you asked them a second time, did they get that notification? So that way your leadership has the data they need to see if this is an ongoing issue or recurring issue so we can tackle it. All right. Two other options. Option number two, I recommend picking up the phone and calling them, okay? Or using the radio, whatever you typically do, and trying to get a hold of them saying, hey, did you get my eBridge? Third option, go ahead and try and call through the platform. You guys already know this works via data, okay? It's not like a direct phone line communication. So whenever you press call ED, it's automatically going to go over to the hospital and you guys will be able to have a data call if you needed to. So those are your three ways of communicating with one another. You now have a live chat through this platform. You can call them via regular, or you can call them through this area here. Now, I want to show you guys really quick. Keep an eye on, for example, if I say I want you to go to triage, that is going to update on your device over here. Now, it's not going to ding. It's not going to make an audible noise because we don't want to annoy you in the back, right? The only time that you will get an audible notification is when they acknowledge or don't acknowledge, and if someone is trying to get a hold of you. Okay. So when they update the room number, you'll be able to see this here. You'll also be able to see it here and in your case history, right? This little clock down here where all your recent transmissions live, this shows you're transporting. It's going to tell you right here which room you're going to as well. All right. So you'll be able to pull this case open and then, of course, see that here. Now, another option is if they are chatting back and forth with you, they may ask, for example, we had a case the other day where a patient was seizing and the hospital wasn't sure if they were still seizing or if they stopped seizing. So they simply asked via their chat. They went through here and said, you know, I can't type today. Are they still seizing? You're going to get that on your side. It's literally just like a text message. And then you're able to respond and say no, and it's going to show them on their side. All right. So you guys are just in a live thread here. I have a ton of hospitals and EMS in my area that are loving this group chat feature. They just find it super convenient and a lot easier than trying to talk back and forth on the phone or the radio. All right. Your next couple options over here to the right. So we have two options here. One is deterioration and one is CPR in progress. So we heavily focused on the fact that we need to update the hospital in real time when we have minimal resources and stuff hits the fan in the back. Okay. I've been in countless situations where we're on the highway, we're 5 minutes away, and my patient codes, right? Tag, I'm it. That means I not only have to take care of the patient, but I also now have to try and communicate to the hospital, hey, stuff changed. Be ready for me. That can be extremely frustrating and very difficult to communicate, especially since they're not in our shoes, right? I'm an octopus in the back, sweating my butt off, trying to do 15 different things. I have the phone up to my ear, or I'm trying to communicate via radio, and I don't get the best response. Or better yet, I get asked a question, for goodness sake. And it just causes uproar, really. So now we have quick options for you to be able to notify them when something's changed. All right. So first, I'm going to go over the deterioration. So when you press the deterioration yellow button, you have three different options. One is patient condition worsened. Okay. Two is airway. Airways meaning I need resuscitation at bedside, or sorry, respiratory at bedside when I get there. All right. Now, I may be in the process of grabbing an airway. I may have already gotten an airway. Regardless, I need that team next to me whenever I arrive. That's what that button will do. Resuscitation team is literally the same as the CPR in progress, but we wanted to give you two options because in a time of stress, you may forget, right? So the only one where you're going to be able to essentially ask for more or need to provide more information is patient condition worsened. All right. So I'm going to show you airway needed first. When you press this button here, it automatically alarms the hospital. And you'll notice it now tells them, hey, we need respiratory. So they're going to page respiratory so they can be at bedside for you. But notice this right here. This timestamp is gold, guys. It's going to show you this EMS at this time and this date told me they needed this resource. All right. So it just gives you a really good paper trail to show you're doing your part. All righty. So there's really no other questions needed, right? Hey, I need respiratory at bedside. What else do you need to know? I'm busy back here. Stuff happened. All right. Next, going over patient condition worsened. So if we press that, they're going to get that on their side, that the patient's deteriorating, but they're going to be taught, you need to go up, they're going to be taught to look through this form and figure out, okay, what changed, right? Like what's going on, what happened. This is where you have multiple ways to notify them of what changed. You can use the chat function. Chat what's changed. Put something in the narrative in the open text box, right? Use a talk to text. Add a new audio clip of what's going on, and they're going to be able to see that. Or simply start going in. Let's say, for example, they originally had within normal limits, but now their pressure is, 80/40. I lost Lost my heart rate, still trying to grab it. Their respiratory rate is literally nothing. Their O2 stat's 80, and we can kind of go from there. You'll notice they're getting it in real time. All right. So with patient condition worsened, make sure you are updating something, letting them know what changed, so that way they can understand what's going on and be best prepared for you. Last but not least, this red button, my favorite. Excuse my language, but I call it the oh shit button, because when you're in the back, again, that's essentially what's happening, right? It's something where you did not, it didn't start this way, right? But while you're en route, this is what's going on. You need a quick way to notify them so they can be prepared for you whenever you're pulling in. You're going to be able to press this button here. It is going to ask you to confirm, simply because it goes absolutely crazy inside the hospital side. So they're prepped. When you press confirm, you'll notice it goes to the hospital. It's a crazy tone. They have to open this up. It not only timestamps it right here for you, but again, it alarms them and starts to flash. There's no other questions, right? There should be nothing else that's needed. CPR is in progress. Be ready for me when I get there. All right. So those are your functions through this platform. Just keep in mind, you are now in a live environment. This should be so much easier for you guys to use as you start to, transition to this model, and the hospital starts to transition as well. It is change, right? It might be a little rusty in the beginning or a little rough, but give each other some grace and just work through these processes. I'm going to show you what this looks like over here whenever the image is opened as well. Don't worry about the orientation of this stuff, guys. Whenever you take the photo, they're able to transition it as they need to, and they can zoom in and zoom out. If this was not a good picture, I would not be able to see grid lines, right? So please make sure it is not a fuzzy picture, not a fuzzy picture. I cannot reiterate that enough. Alrighty, so essentially they assign the room. They can also update the room, right? So you now said the patient coded, and we now want you to go to room 1. So I updated room 1. You'll notice over here, it's not only going to update on your device, it's also going to update everywhere else for room 1. Okay, and your dashboards that you may view whenever you walk in to the left or to the right, you're going to be able to see that you're going to room 1. Okay. All right. So same with let's not look at that. My demo's not set up for that part. But now I want to go over some of these other forms as well, just to quickly give you guys some insight for the STEMI, stroke, and trauma processes. And again, just reiterating here, guys, this little clock down here is going to show you all of your recent transmissions, and those should be on your device for 12 hours. Next, we have STEMI. So STEMI, same concept, right? It's just going to show you your hospitals for STEMI. You're going to have your quick attachments that live up at the top. Don't worry about this mode of arrival. That is not going to be there, because it's already going to know who you are and how far out you are. So you don't have to worry about that. And some people like to ask, could I potentially start this in the house, for example, and press notify? Is it going to update my GPS as I start moving? Yes. Same thing. Do you get stuck in traffic? Do you have to take a reroute? Whatever the case may be, this application is live tracking. All right. So please feel free. Get used to being able to use this potentially in the house, and then you can just get to work in the back. You don't have to worry about doing any of this stuff. All right. Same with the demographics. Let me grab my driver's license here. We're going to automatically pull this in. If my stuff wants to work with me now, there you go. Pull that in real quick. Now you'll notice the chief complaint's a little different. It's geared towards STEMI. So this is going to give you a ton of quick options here. We'll say they have the whole 9. Then I go into, is there any pertinent history? Yes. I can actually press send, guys. So this is your leadership is going to tell you the bare minimum needed prior to pressing notify. I can tell you what we're doing here in the St. Louis area. They need to have at minimum an EKG, demographics, or as much as they can grab for the age and sex, a little bit of background on what the complaint is, right? Chief complaint, any pertinent history. Then they're able to press notify. When they press notify, you guys obviously see it's going to go over to the hospital side. So they're going to get this on the hospital side, and then they're going to start to open up this EKG. And while they're going through their process, I can start updating this in real time. All right. So they're going to look at this EKG here. Let's say we pull this to the side for a second. And now, as you are updating your vital signs, they're able to get that over on their side as well. And you'll notice that as you can see that there. Okay. They grab that. Anything else? Treatments again, if we're able to give anything, that's helpful. And go from there. Okay. And that's kind of what that looks like for STEMI. And again, it essentially took me less than 60 seconds. It showed a minute, but that's because I went back, adjusted things over here, and came back to this here. All right. So that's your STEMI. They're going to be able to acknowledge you. You get that notification on your side, the closed loop. They can update. Say we want you to go to room 2. You're going to get that over on your side to know that you're supposed to be going to room 2. And that's it, guys. And then you're in a live thread if you need to chat back and forth. Okay. If they say, hey, can you take a right-sided? No problem. Right. I can go in. I'm going to say, there you go. You're going to get that over here. Perfect. No problem. I'm going to take a right-sided. Let's say I take the photo of the EKG real quick. I update it, and then I can let them know that it's updated. And then they're going to get it on their side. And now they have 2 images, right? Pretty straightforward. So same for, let's bring this over and just quickly go over the stroke and the trauma. For stroke, attachments are always going to live up at the top, guys. If you want to go ahead and grab that video of that stroke assessment, highly recommend. Demographics, same thing. And this goes into your stroke scales. Your leadership will talk to you about what those standards are, what those processes look like. But essentially, you have your Cincinnati. You also have your FAST ED. And then for BFAST, what I've utilized on my side, or at least in my area, is if you have something positive in one of these areas, that's where you're going to need to use it. If there's nothing positive there, don't worry about it, right? Or if you want to go above and beyond, you can put null, but there's no need to put it in there if you don't want to. Okay. Last known normal, blood thinners, any pertinent history, and then it goes into vitals. So here in the St. Louis area, we have to, again, fill out everything prior to vitals before we press send. Once we press send, we can fill out our vitals and our treatments to update them. And that's sort of like our standard that we go with. Totally up to you and your leadership how you want to tackle that. Next is going to be your trauma. This, again, is for all levels of trauma, guys. It could be a scrape on the knee, or it could be your full-blown vehicle accident that you have, right? This is something I highly recommend ensuring that you attach a picture of that vehicle accident. Please use this. You are going to get a better response when you get to the hospital, and you're going to be doing a better job of being a patient advocate, okay? You're going to be doing better of just making sure that they have the right teams ready for them. So go ahead and grab a recent photo that you took of your vehicle accident, or again, grab that photo of a wound, whatever it may look like. We actually just had a case. I had a brand new EMS go live, and the first time they decided to use this was for one of their traumas and just a really bad ankle injury. But it obviously could show that ankle injury was not triage appropriate. They had an open injury, so they were able to get a room just simply by showing the injury and what was going on, right? Because over the phone, that may be a little bit difficult to describe. So same thing here, demographics, trauma is used to having Jane Does, John Does, just age or approximate age and sex. So if you have the info, great. If not, don't stress about it. But trauma is going into a different model. So this is something where we don't need to focus so much on leveling in the field, right? Because we're not able to keep track of all the different hospitals and all their different criteria and all the different things going on. That's not necessarily something that we are responsible for. Our responsibility is to paint the proper picture so that way the hospital can level appropriately. All right. So we built this based on mechanism and injury. Simple as that. Now you'll notice here you have a ton of different check boxes because we know with trauma, it's down and dirty, it's quick. We don't have a whole lot of time, 90% of the time when it gets to it. So you'll be able to click this information here. Again, you guys are kind of used to using this already as far as the check boxes, or you would be, and you're able to go in and paint a really good picture of the mechanism. Then it goes into, is there any high risk due to that mechanism, right? Or was there any high risk criteria built in? Was it over a 20-minute extrication? What the intrusion look like? Do they have a positive seatbelt sign, etc.? Make sure you're clicking any of those. And then it goes into head to toe. So if there's something in the head or neck, pop it open. If not, don't worry about it, right? If there's something in the extremities, go ahead and pop that open. So it's going to have all of the appropriate descriptions or criteria built in. If something doesn't fall into there, we haven't seen that be a major issue, but you can always put info down in this notes section if you needed to add more info or anything like that. But most of the time, all of their leveling criteria, meaning 1 through 3 or 1 through 4, depending on certain areas, we're 1 through 3 here in St. Louis, is built into these criteria here. This is what they're looking for. Any blood thinners, and then of course, again, it goes into your vitals, GCS, which is key here, and your treatments. Alrighty. So head and neck, we'll just go ahead and pop some of these open. You guys are going to be able to see this on your end. You'll have a training environment to kind of go in and mess around with some of this stuff. Highly, highly recommend once you get this in your hands, just go through with it and kind of get eyes on all the different forms prior to you using it for the first time, right? So just so that way you're a little more comfortable. You can even just start to use this for your lower priority patients, getting really quick and efficient at it. And before you know it, you're going to want to start using it for your time critical type patients as well. So just let me know if you have any questions, concerns. We're here to support you. I want this to be really successful for you. Hopefully, I didn't miss anything. I'm really excited for you guys to use this new model. I think it's going to help tremendously. And what we've seen here in our area, again, is it just organically alleviates a lot of the miscommunication that we never realized happens. So this is going a lot of places in the future. We have a lot of fun things coming soon, but hopefully you love this new model. Please, again, don't hesitate to reach out if you have any questions, concerns, comments, anything like that. We're here to ensure that this is a tool that you want to use and not a nuisance or something else thrown in your lap that you have to tackle. All right, guys, hope you have a great day, great week, and we'll talk soon.